Local and international NGOs have decried a decision by US President Donald Trump for a 90-day pause in foreign development assistance pending a review of efficiencies and inconsistencies within his foreign policy. The United States is the largest single donor of aid globally, disbursing $72 billion in assistance in the 2023 fiscal year. For more, we're joined by Chairperson of the Southern Africa HIV Clinicians Society, Dr. Ndiviwe Mphothulo, and Director of South African Programs and Advocacy at MIET Africa, Dawn Jones. A very good evening to you both. Thank you so much for your time. Perhaps, Dawn, let's start with you. As we learn of what has happened over the past 2 weeks, the letters being sent to US grant recipients following the stop work order, what does it mean as we, receive these letters and really take stock of what it could possibly mean for millions in South Africa?
Thank you, and thanks for the invitation. It means a lot. We are all absolutely devastated. The impact is not just what could the impact be. We know that the impact is going to be very bad. The impact is on those that work in the sector. The impact will be felt by those that the sector serves. And we know that when we experience the shutdowns and disruption during COVID, for example, we saw the impact that had on gender-based violence, HIV and AIDS, people being able to access TB medication. The areas that we work in are serving the most vulnerable populations in our country and across the SADC region. And so the impact is not just felt by the organizations that at this moment are literally closing their doors. It's it doesn't help us to say it's a pause. It's a 90-day pause. It's 89 days too long, because what we lose during that time, the ground we lose, the organizations that close, because resources are not negotiable. We have to have them to do the work that we do and serve the population that we serve. It's too long to try and rebuild that again after a decision has been taken. It's not impossible, but it will take a lot of time. And I think we are going to see, we've just been looking at footage of a fire, and we're thinking recently about the LA wildfires. This is going to be like a slow burning fire that's out of control.
As we try and make sense of that, Dr. Mphothulo, what kind of a threat does this pose to South Africa's health programs? We're talking here about what we saw during COVID-19. Now we're talking 90 days, which, Dawn has emphasized that it's too long a pause.
Good evening to you and the viewers, and thank you for inviting us. I think, putting it simply, if you stop HIV funding, what you basically doing, you are jeopardizing HIV prevention and treatment services, which has dire consequences for the country, as it may increase new HIV infections and deaths. That's what it simply means. So it has dire consequences for us as a country. If you remember, world leaders in around 2015, 2016 sat together and put targets that we want to end HIV/AIDS as a public health problem by 2030. So they had put 90 targets, but they've now increased them to 95. So that essentially means they wanted to have 95% of people who are HIV positive knowing their HIV status, and 95% of those who know their HIV status to be on ARVs, and 95% of the people on ARVs have a sustained reduced viral suppression. So funding comes handy in us achieving those 95 targets. And it was put that we should achieve those targets by 2030. So if you cut off funding, it means the world will not reach those ambitious targets it put for 2030.
And Dawn, just trying to get a better understanding and more clarity, what is your understanding on the freeze? Has it come into effect? Have we seen it taking place already, or are we still going to learn of a freeze and these letters being received?
So the organizations, as I say, this is a massive sector, and I think people sometimes think it's just small little organizations. We, for example, employ about 450 people. Our targeted reach in 1 year can be as much as over 500,000, and that's just one organization. And although some organizations aren't specifically receiving that funding, the US funding contributes to other funds. So some of us are waiting to hear whether the fund that we perhaps are relying on is going to be as badly affected. But other colleagues, I was in a meeting today, and people said there's blood on the floor. They are closing their programs. I've got colleagues in other organizations that are already receiving letters that they're being retrenched. So it's happening. The problem with development work is that it's not always prioritized. And so the problem we face as organizations to do the work we do and to reach the numbers that we reach, and as Doc says, these are targets, and they're targets for a reason. We have a massive young population in our country and in the region. And so at the end of the day, if we ignore that population, then we are failing them. So the letters are slowly coming in, and organizations like us and everybody else, we don't have funds, big reserves like businesses that we can rely on for a month or 2 months or 3 months. We have to take that decision now. Organizations have to say, look, we can't wait out 90 days without funds. And that is what I think is such a tragedy, is that it doesn't matter if it's a pause or it's an entire hard stop. It's going to have a dramatic effect on who we serve, on young girls and women, not only in terms of HIV, but the things that go with it, TB. If people cannot get the services they need, and young people in particular, and they cannot get their ARVs, then you lose them, not necessarily to death, but you lose them in terms of the momentum. And that is very, very difficult to get that back. At one time, I remember during COVID, one of the researchers saying we were sort of on the edge of a precipice in terms of the gains we had made in this area, of serving the young people in our country in this way. It feels like after the last few days, we all hanging on just by our fingers, waiting to drop and see what's going to happen.
Yeah.
And ultimately, we cannot stop what we're doing. And everybody has to come together, private sector, civil society, whoever it is, to help us continue doing the work that we do.
Dr. Mphothulo, Dawn speaks about gains being reversed. You spoke a bit about the impact in terms of how this will derail targets that have been set in the fight against HIV. And with that in mind, I know that South Africa is one of the biggest recipients of the PEPFAR aid, receiving just over $300 million in 2024. What does this mean in terms of the bigger picture and where we're standing? I mean, Dawn touches on losing them with the momentum. What will it mean should these funds not be made available? How will we count the ripple effects on the fight against HIV?
Yeah, as I've said, the consequences are dire. Even though the South African government, I think it contributes about 77% to the treatment program in terms of HIV and TB, but PEPFAR, I mean, contributes about 14%, which is very significant. So if you have a problem with funding, first thing, as I've said, is disruption of treatment services. So if you cut the funds, there will be disruption of treatment services for millions of people living with HIV who are managed by the NGOs. Remember, NGOs play a very important supporting role. They are technical supporters to the government. They do what the government cannot do in terms of tracing patients who are lost to follow up. Remember, we said the second 95, we want 95% of the patients to be on treatment, but you sometimes lose patients, and ordinary government employees are not able to trace those patients, but you have NGOs able to trace patients. You have NGOs having a skill of doing monitoring and evaluation. So if you cut the funding, you've got those problems. Another problem I think Dawn spoke about was a very important issue of a high rate of new HIV infections in young women. So we've got a problem in South Africa that we have high number of young women between 15 and 24 getting HIV infected compared to their peers. So PEPFAR helped a lot in terms of prevention services, provision of PrEP, peer counseling, having the support groups for young people. So if you cut funding, it means you're going to have more young people getting infected with HIV. You also have a group called key populations. I think, that's the term. It's key population. That group includes sex workers, men having sex with men, transgender people, So those people are at higher risk of getting HIV more than the other populations in the country. So these NGOs have been able to connect with these key population groups, have been able to connect with young women in terms of preventing new HIV infections, because the world leaders themselves, they've said, for us to be able to make sure that HIV and AIDS is not a public health problem by 2030, we need to reduce the new HIV infections by 90%. So prevention is a very important service of this 95 program. So cut funding means you have new infections.
The ripple effect is quite frightening. Thank you so much. Thanks for weighing in on the discussion as we wrap up that conversation there with the Chairperson of the Southern Africa HIV Clinicians Society, Dr. Ndiviwe Mphothulo, and Director of South African Programs and Advocacy at MIET Africa, Dawn Jones.